I'm Ahava. Welcome back to What Did You Learn? I'm so excited today to have Sandra Mackey, who's the Chief Marketing Officer at Bon Secours Mercy Health. Sandra, welcome. Thank you so much for being here.
Thank you so much, Ahava. Really nice to be here.
Awesome. So I always like to ask people, just so that my audience can get to know, kind of an icebreaker question. What was your favorite kind of ice cream to eat during the pandemic?
I'm not a huge ice cream fan, believe it or not. But if I do eat ice cream, it is strawberry.
Oh, yum. Okay. And so if you're not an ice cream fan, what do you like instead?
Sweets. And I try to be a little bit better about sweets and try to consume street sweets of the fruit kind. So strawberries. I ate a lot of strawberries over the summer.
That's the best time to eat them. When you find a good strawberry ice cream, though, there's nothing like it.
Nothing like it.
Especially like a gourmet ice cream shop. I mean, and especially in the summer, it's the best. So tell me, we're almost at a year point now where this hit us, and you've had quite a year, I'm sure. And I want to hear from you, what have you fallen back on in your leadership that has allowed you to continue to maintain quality communications, not only with your audience, but with your internal staff and also your direct colleagues and who reports to you?
Sure. Great question. Thank you so much. I think one of the things that this pandemic has taught us, it is that we should not ever try to forge something as big as this alone. And I have been absolutely amazed and very, very grateful for the relationships that I have throughout healthcare. And I've found that so many healthcare organizations have really come together around sharing best practices, around communications. I'm part of several groups, and we intently, really since March, have been meeting on a frequent basis to share information, because at the end of the day, it's all about how we can help each other help the patients that we serve. And, patients, they don't want to hear about competition. They don't want to hear about, whether they should come to our hospital versus another. What they do want to hear about is real solutions as it pertains to managing through this devastating pandemic that has just ravaged our world for almost a year now.
Yeah. So it's interesting that you say that about the best practices. Was that happening at the chief marketing officer level, or was it happening even at higher levels than that, or, director levels? How was that communication being managed?
So I think there's a number of professional organizations out here that certainly chief marketing officers, but others rely on to really share best practices, glean new innovations, things of that nature. I would say that there are probably, certainly for me, probably two organizations that I've been very heavily involved with. And so what I saw through this pandemic was an expansion of those organizations, an expansion of the knowledge that we were sharing with one another. One of the things that we did with one of the organizations that I'm part of is on a weekly basis, invited CEOs from health systems to come in and share best practices and really sort of download the challenges that they were going through at the health system level, to have us all thinking about ways that we can tackle this together. Things like the Mask Up campaign became a national effort with more than 120 healthcare organizations coming together. That's unheard of. That's never happened before, and not in my 30 years in healthcare.
So the pandemic hits, and then Black Lives Matter hits, and now the vaccine rollout hits. How do you feel like you learned from each experience how to sharpen your communication? Have you become more vulnerable, more focused on function and operations? Like, what's happened in your own head that has, directed sort of your leadership?
That's a great question. I think first and foremost, we have really come together in an even more compelling way across our leadership team in terms of sharing information. Everybody on our team's a communicator at this point. And, this is something that I think we've dreamt of for years and years. And the role of communications has become critically important as we battle through the pandemic. So it really has been great to see that all uh, sort of come together and gel. What we've learned from it is that one size does not necessarily fit all. And certainly across our markets, there are different challenges. You know, we're a health system of 50 hospitals, over 1,000 points of care, and we operate in 7 states in 2 countries. So when you think about the challenge of trying to create a standard message that goes to all, one of the things that we learned is that we have to custom tailor our communications to meet the needs of local markets and make sure that we are meeting people where they are. And so it has been phenomenal just working alongside clinicians who are helping to raise the awareness about needs that patients have in their communities, and then be able to help them custom tailor those specific messages to those communities in a very direct and personalized way.
But I love what you talked about meeting people where they are. And as a content professional, what I start thinking about is, did you use personas? Did you use technology? Like, how did you, that's such a huge amount of hospitals and points of care, 2 countries. Like, how did you even think about how to get there?
So I would say all of the above. This is truly a way in which our omni-channel marketing approach really came to fruition, right? When we're thinking about how we, listen, we are a listening ear to the communities, we're listening to the concerns that consumers have, and we're using all of our available resources in our toolbox to reach them. There really wasn't a one size fits all approach to being able to communicate with both our patients and consumers. And so we used everything that we have, from social media to really direct messaging using my chart, electronic medical records, to really be able to reach patients as well. So really putting all of those available resources on the table, and knowing that nothing was off the table in terms of how we reached our consumers using our CRM, and many other tools in our toolbox was critically important.
Do you feel like you had to learn more about how these things really operate at a very detailed level than you ever have before? Did you already know it? Like, what was your educational learning curve like?
Oh, absolute, the absolute learning curve for me. You know, when you're a chief marketing officer, you tend to fly at the 30,000 foot level, and you hire really smart people with great expertise in lots of areas, and that's certainly the case. I think it was really, really a lesson learned, and great information for me to be able to dig in at a little bit more granular level, because everybody had to roll their sleeves up. And so not only me, but I'd say many of our people on the clinical side, many in operations, had a newfound respect for all of the tools available to be able to communicate both internally and externally to meet the needs of our customers.
Yeah, it sounds like your group really got together and just said, like, we're going to make this happen. How can everybody bring their best to the table?
Absolutely.
So speaking of that, and being a manager myself, and wanting to be the best manager I can be, did you start to notice burnout, or how did you manage sort of the behavioral health implications of people working like this? How did you talk to your staff? How did you do check-ins? Like, what did that look like in such a vulnerable situation?
It's a great question. So, if anybody had told me in March that almost a year later we would still be at this, I probably I would not have known quite how to wrap my head around it. Or, um, I think I may have taken a step back and wanted to sort of document a playbook or a plan for how you would manage keeping staff engaged and involved, and really managing their mental stress throughout this. I would say that, as a Catholic health ministry, one of the things that we lean on very heavily is our mission and the values that we bring to the table. And so We pray, we offer reflections a lot. Our faith really helps to guide us, and certainly in this situation, our faith really was at the forefront of how we have managed day to day through this. But as a leader, it also takes some very deliberate actions, right? So, not just hoping that we pray before every meeting, but really offering reflections that are meaningful, understanding where people are, understanding what their stresses are, and taking very deliberate timeouts to do some things that really help people sort of unwind a bit, which is when you're not in person. We've been working remotely for quite some time. When that happens and you're not in person day to day, it does take its toll. And so ensuring that we're spending the time in a very deliberate fashion, um, coming together and having we formed a book club that we're trying to take a deliberate time out to refresh, and really think about ways that we can be more effective. And we've encouraged across our ministry all staff to do the same, do something to establish a sense of normalcy in a situation that is anything but normal.
So I love what you said, because I haven't had many CMOs or, the people that I've interviewed talk about the effect of faith as a part of how they manage this part of it. And I think having that as part of your code sort of really does help to sort of smooth the runway to those conversations. When the Black Lives Matter, movement sort of hit, how did that faith lens help have those more, those rougher around the edges conversations where people were so raw?
Oh, I think that was in the midst of a pandemic, just when you thought that nothing else could possibly go wrong. In the midst of a global pandemic comes a social justice movement that really just shook the world to its core. And
Yes.
so leaning
Make people face demons that they may not have known that they had,
absolutely,
which is
absolutely.
so hard.
Absolutely. Facing, the worst demons that you can imagine. But, it was also a very positive time for a conversation that may not have taken place had these unfortunate incidents not happened, right? So I think it was a critical time for us to be very open, very transparent. One of the things, and again, I'm going to keep on coming back to one of the reasons why it's great to be a member of the Bon Secours Mercy Health team. We had worked through some diversity and inclusion initiatives dating back to when we first came together as a ministry in 2018. And so this just really accelerated a lot of the work that had already been in place. We trained more than, you know, uh, I think it was like 2/3 of our associates we trained in diversity and inclusion. We're very open and transparent in talking about diversity challenges. And so when this all emerged, our CEO was just incredible. He really walks the talk, and this situation was no different, right? He came out very quickly, um, uh, denounced racism, and really ensured that his voice was being heard across the health system. And so I think that really gave everyone permission to do the same, to have very tough conversations, to really engage in the kinds of dialogue that helped to start the healing process. And so that was really, really important. If we're not addressing these issues and having those very transparent conversations, the healing never really begins, right? We continue to gloss over it in the hope that it goes away. And I think the leadership that certainly our CEO showed and our board was incredibly committed to this effort as well. So it really was modeling behavior from the very top of the organization.
Okay, so we're a tighter team. We're more collaborative. We trust each other more. what does marketing look like in the next 18 months?
Oh, that's a great question. So, I think
After you take a vacation and eat all the strawberry ice cream you want.
that day will come. I'm sure that day will come. What does marketing look like? I think we've learned a tremendous amount. We're all in this together, not just healthcare, but everybody has fought through this pandemic together. And so I think locking arms and understanding ways that we can better engage versus just feeling like we have a one-way conversation with consumers is definitely that's our true north going forward. While it has been in the past, I think it's strengthened even more going into the future as we think about ways to engage consumers and not just talk at them.
Thank you so much.
Thank
Sandra,
you.
where can people find you?
People can find us at we have two brands, the Bon Secours brand and the Mercy Health brand, depending on what market you're in. And so we operate, if you're in Ohio or any of the states, Ohio, Kentucky, or anywhere that has the Mercy Health brand, you can find us at mercy.com. And if you're operating in Bon Secours markets, bonsecours.com is the best way to find us.
Awesome. Thank you so much, Sandra. It was wonderful having you.
Oh, great to be here. Thank you so much.
Thank you.